Good morning, everybody. Welcome to the October 13th, 2020 meeting of Henderson County Fiscal Court. We're glad you're with us. And as always, we will begin with a prayer. So if everybody would join me for an invocation. Dear Heavenly Father, please look over this group as we make decisions for our community to try to help our citizens, our neighbors, our friends during these very challenging times. Please look over our first responders and all our medical health, public health professionals as they work with us to protect our citizens. Please look over our military personnel serving here and overseas. Please bless this community, protect this community, and help us do the things we know will help this community. I say all these things in Jesus' name, amen.
Amen.
Please join me for the Pledge of Allegiance. I pledge
allegiance
to the
to the flag
of the United
States of America
and to the
and to the republic
which is
for which stands
one nation,
under
God,
God,
indivisible,
indivisible,
liberty and
with
justice.
liberty and justice for all.
Mr. Clerk, would you please call the roll?
Master Berry.
Here.
Master Southern.
Here.
Master Moran.
Here.
Master McCullum.
Here.
Master Putman.
Here.
Thank you. And ladies and gentlemen, you have before you the minutes of the September 22nd Henderson County Fiscal Court meeting. After a period of review, I'll entertain a motion to approve those.
Motion to approve. Second.
We have a motion from Master McCullum, a second by Master Berry. Any corrections, clarifications, or additions? All those in favor signify by saying aye.
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 Any opposed? Thank you. We have a couple proclamations this morning. Very important issues that we are recognizing. And we have with us Andrea Robinson, who's Executive Director of Oasis in our community. And we have a proclamation acknowledging that this is Domestic Violence Awareness Month. And before we read the proclamation, I'll turn it over to Andrea to address the court and fill us in a little bit more on this initiative.
Thank you so much. As mentioned, October is Domestic Violence Awareness Month. And this is a time where we can bring heightened awareness to our cause for all victims of domestic violence and all survivors of domestic violence. But our mission continues on every day of the year. Henderson is our second largest county in the Grad region that we serve, and we appreciate and acknowledge the court for recognizing and sharing in this mission with us. And we hope we'll be able to continue a strong partnership to ending domestic violence.
Thank you. And we recently attended the ribbon cutting of an organization that will aid in the effort to bring awareness to and perhaps funnel to Oasis domestic violence cases. That's the Chloe Randolph organization, which opened up an office on First Street, right on the corner from courthouse. And again, just yet another group of people who care about this issue and want to help. And we appreciate all that Oasis does to help our citizens and people who find themselves in very dangerous situations and try to get their lives back on track in a safe manner. So,
yes. There can never be enough of us. I mean, we all have to work together to work through this issue. So we're grateful for everyone that takes this issue to heart.
And we all should.
And the Randolph family as well.
Yeah. Okay, with that, I'd like the clerk to read our proclamation.
Whereas domestic violence is a behavioral pattern used to establish power and control over another through fear, intimidation, and abuse. And whereas annually 3 million men experience domestic violence, and 1 in 4 women will experience it in their lifetime. And whereas domestic violence does not discriminate, affecting all ages, races, genders, and income levels. And according to HUD, domestic violence is the third leading cause of homelessness among U.S. families. And whereas 2 of 3 female murder victims are killed by a family member or an intimate partner, and children living in violent, abusive homes are likely to suffer from physical and emotional health issues and with difficulties in schools. And whereas annually, America spends $37 billion on domestic violence related medical expenses, sheltering and foster care, law enforcement and legal costs, sick leave, absenteeism, and low employee productivity. And whereas without a coordinated community effort to end this heinous crime, girls witnessing domestic violence are more vulnerable to abuse, and witnessing boys are likely to become perpetrators, thus continuing the cycle of violence. And now therefore, I, Brad Schneider, by virtue of the authority vested me in County Judge Executive of the County of Henderson, Kentucky, do proclaim the month of October 2020 as Domestic Violence Awareness Month in Henderson County, Kentucky, and encourage all citizens to learn more about preventing domestic violence and to support and show appreciation to the many local agencies and volunteers who provide protection, advocacy, and assistance to volunteers.
As a former board member of Oasis, I'd like to make the motion to approve.
Second.
A motion by Master McCollum, a second by Master Moran. All those in favor say aye.
Aye.
Any opposed? And although we don't want to celebrate domestic violence, we do want to celebrate the people who are trying to solve that issue and protect people. So how about a round of applause for Miss Andrea Robbins?
Thank
Thank you,
you
Andrea.
so very much.
Thank you for being here. We also have a proclamation. This is Kentucky Extension Homemakers Week. And in part of my effort as a member of the local extension board to help create more awareness about all the great things extension offices do, I'm glad to see this proclamation. And Marilyn Wilson, are you with us there? Need to unmute. Come on now, don't laugh. It's happened to you during these.
That's why it's funny.
Yeah, it's not my
All right.
computer.
Marilyn, we're going to read a proclamation for Kentucky Homemakers Week, but before we do that, you want to say a few words to the court about this program?
Kentucky Homemakers, yes. We are not as strong in numbers. Of course, the coronavirus has done a lot with us and we've not been able to volunteer as much, but we have several different educational programs, like 8, and we try to educate throughout the state. We have leadership development, management, safety, environmental, energy and housing, family individual development, food, nutrition and health, international, 4-H youth development, cultural arts and heritage, and marketing and publicity. And through those, we have several different programs that's given to each county throughout the year. And we meet from July until June. And cultural arts is usually June month that you travel the state and visit all of our arts and history and creative writing and things like that. But I also have with me Karen Hill, and she is our KEHA president for this next 2 years yet that she has in her term left. So Henderson County is very fortunate to be represented on the state level of our homemakers.
Thank you, and I love it when local people hold officer positions on state organizations. I really do. So thank you for doing that, Karen.
You're welcome.
And for all of you who have been involved at Extension in 4-H or any of their programs, you probably understand why it is a really important, probably underappreciated portion of any community's efforts to help their children, their teenagers and adults better their lives and develop leadership skills, and also skills that help in the home, like the homemakers. So thank you for all you do. I really appreciate that. And when we emerge from the pandemic, I hope those programs will kick back up to previous enrollment levels and enable you to get out and get more volunteers. So good luck with that. We're all appreciative of what you do. With that, I will turn it over to the clerk to read our proclamation for the homemakers.
Whereas the Kentucky Extension Homemakers Association Incorporated has more than 13,400 members in more than 800 clubs throughout the Commonwealth. And whereas since its formation in 1932, the Kentucky Extension Homemakers Association has strengthened individuals, families, and communities through education, leadership development, and community volunteer service, and has focused on improving the quality of life for families and communities. And whereas this organization over the years has continued to endeavor to strengthen, develop, coordinate, and extend adult education in family and consumer sciences in cooperation with the Cooperative Extension Service of the United States Department of Agriculture and the University of Kentucky. And whereas, although this year's COVID-19 virus has severely limited volunteer participation opportunities, the 88 members of the Henderson County Homemakers Association have made and donated masks to a number of county businesses and organizations, to include the Henderson County Schools. Now therefore, I, Brad Schneider, by virtue of the authority vested in me as County Judge Executive of the County of Henderson, Kentucky, do hereby proclaim the week of October 11th through the 17th as Kentucky Extension Homemakers Week.
Thank you. And it'd be great to get a motion for that.
So
As a
moved.
We have a motion from
Second.
Magistrate Moran, a second from Magistrate Putman. All those in favor say aye.
Aye.
Any opposed? Thank you, and thank you for everybody out at the Extension Office for tuning in. Thank you, Marilyn. Appreciate that. Thank you, Karen. And I saw
Thank you.
Amanda back there in the background taking pictures. Thank you so much. And we will see you all soon.
Thank you.
Thank you.
We have with us DJ Story from Peel and Holland, our health insurance advisors who do terrific work for us. Many people know, and members of the public watching in may not know, that we are a self-insured. We use a self-insured plan here at the county to insure our employees and their families, and that is it takes some expertise to make sure that runs well, and Peel and Holland and DJ provide that expertise. So today, it's that time of year when we're about to update and renew our health insurance plans, and I've asked DJ to come in and give us all an update, show us some data, and also hopefully renew the contract with Peel and Holland to help us in the future. So with that, I'll turn it over to DJ.
Thanks, Judge. Thanks, Court. Pleased to be here today. Happy to walk through this with y'all. Feel free and ask questions. A high-level overview, and hopefully we can continue to serve the court. It's been our pleasure for a number of years now, and we obviously would love for that to continue. So I need to share my screen. Make sure that y'all can see that. All right. So does everybody see my screen now?
Yep.
Okay, perfect. I've got a tickle in my throat, so of course I'm going to try to cough through all this thing. So high-level overview of financials and benchmarking with other area employers to kind of say, how are we doing in offering health benefits to Henderson County employees versus the marketplace. Wanted to give you all a little bit of an update on that as well. Talk through the 2021 renewal and then recommendations. Keep it short and simple, for this review. So financials, this year, when we look at this chart shows a healthcare cost per member per year. So that's taking all things into consideration, the claims costs that we pay, the amount that we pay for premium and insurance pieces, for administrative costs as well. And then we want to look at that versus the number of members we have on the plan. Excuse me. Number of members we have on the plan, that's employees, spouses, and dependents. Okay. So you see this top line graph here is showing that the number of members that we've had has actually decreased the past couple of years. Our claims, our actual costs have increased slightly or projected to increase slightly. I apologize. So our cost per member per year is projected to go up this year to $6,770. That's higher than we've had in the last few years. The factors involved in that, part of being self-funded, you're betting on having good claims years. Every so often, we have a claims year that's less than desirable, right? We have people that are unfortunately sick or injured, have to go to the hospital and have large claims. In those years, we see our costs increase overall. The important thing to note is that we have protection on the back end to help with that. And the other piece is that good financial management allows us to smooth that curve overall. When we're looking at the annual cost details from a large number perspective, we're looking at our claims costs to be about 1.4, almost 1.5 million by the end of this of 2020. And just as a reminder, these numbers are looking at calendar year, not fiscal year. Sorry, cannot get that out of there. 187 is the amount that we're getting in reimbursements. Take a drink. Excuse me. 187,000 is what we're getting in reimbursements on stop loss, or what we're projected to get. Reimbursements on stop loss, once someone exceeds a threshold of $100,000 in claims, the stop loss carrier, in this case Anthem, takes over. So the court does not pay those claims in excess of that. Like, for an example, if someone was to have $1 million claim, say they were hospitalized for a very long period of time, and they were the fiscal court will be on the hook for claims up to the first 100,000, and then after that, the insurance carrier would take the rest of that claim for that given year. Okay, so in this case, we've had folks that have exceeded that 100,000 threshold, in the tune that we're going to not have to pay $187,000 in claims cost for those individual members. That's a good thing, right? That protects us. The negative side of that is when the insurance carrier has losses to that level, it increases the amount they wish to get in premium in order to offset that cost. Okay. The stop loss cost that we paid the last few years has been fairly consistent, about $285,000 in stop loss premium in total. And then administrative costs, that is the cost of just functioning the plan. So administration for Anthem to process the claims and do their job on that side of things. Okay. So we see that this is an increase from what we've had in the last few years. And we just have to be aware of that moving forward. Any questions on these charts?
Yes, I've got one. On
Sure.
on the first chart you had,
Yes.
the approximately about almost $7,000 per member. So if a family of 4, husband, wife, and 2 children, would be roughly around $26,000, pushing 28,000.
Yes. Yeah. This is
Okay.
based on a per member calculation. So you're counting each one of those employee, spouse, dependents separately in this calculation.
Yeah. Thank you.
Uh-huh. And the question comes, is that good, bad, and different? It's kind of hard. We're looking at this in context of multiple years of Henderson County's plan. I would say the per member per month cost here is not necessarily way out of bounds. I don't think we're showing through these claims that we have necessarily all people that are on the healthiest side of things, but also we don't have people that are on the unhealthiest side of things. So I think we're fairly well, we have had, some consistency here. What would be more alarming is if we have obviously a lot more jumps in a per member per year average year over year. We've been fairly consistent. Really a lot of this comes down to some single, unfortunate high claims that have come in this year that are driving a good portion of this. And that is going to happen. Okay. Any other questions on this information? So another thing we wanted to take a minute and just talk about a little bit here was benchmarking. We do an annual, we have done it the last couple of years from a benchmarking study of regional employers and compare that to national averages. When we're looking at the health care plan, the buy-up plan, as we named it in Henderson County's health plan, when we're looking at that buy-up plan, how do we compare to other regional employers, both public sector and non-public sector? And how do we compare that to national averages? And I'm pleased to say that we have a very competitive offering still. So let's look at a couple of these numbers. Employee monthly premium, the average in the single is it's $85 a month. National average at 104. We're at 162. Our total is a little bit higher when we come to that single premium, but we have to also take into consideration that our deductibles and our plan costs actually cover more for folks, and we also are subsidizing and creating an opportunity for folks to add their spouse, children, and family at a lower rate than what is average. The average. Yeah, go ahead.
Can you touch briefly, if I missed it, I'm sorry, but how you made up the local average, 50 area
Yes.
businesses and governments? You took a survey of those to create that local average?
Yes, so yeah, 50 plus employers in this region, both in Henderson, Owensboro, further Western Kentucky, Bowling Green. It's kind of all, we focused on this in a regional basis of West Kentucky. And that's where these numbers are coming from. We've done this for the past few years now. These numbers remain fairly consistent. At Peel and Holland, we obviously work alongside CAECO exclusively as well. So we have a lot of public entities that we work alongside. About 15% of the employers in this average are coming from the public sector, but some are coming from private sector, and that's going to change what the focus is and the cost, the cost averages with those plans as well. But thank you, Judge, for making me point that out. The family premium is $346, which is better than average. We're subsidizing, allowing people to bring their families onto a health plan, much lower than what people can get in the open marketplace. Our annual deductible on the buyout plan is at $2,000. The average locally was $2,387, and I would say among outside public entities is higher than this. The national average is low, but one of the things that skews the data on these national averages are, Fortune 500 companies that are still buying down significant low deductibles. When we look at this from a high deductible health plan average, that number comes back up similar to the local average when we're looking at those benchmarks. Out-of-pocket maximum is better. And then the net healthcare cost exposure, this is taking the out-of-pocket max, the annual amount that people spend on their premium, and reducing out the amount that's available through like an HRA, like we have in the Henderson County plan, and say, okay, if we had to hit that out-of-pocket max, we had a big health claim that came through for somebody, what could they be out in a given year? And the good news is for a single person, Henderson County's plan is better than average. It's better than what the local average is. It's better than the national average. And then for a family, it is even more, it's better there as well. So I think that what this tells us is we have a very competitive plan. We have good offerings for our employees. They're not going to be apples to apples with every plan that's out there, but we're offering coverage that's not, folks can't just get out there in the open marketplace.
And as many of you know, we also, as DJ touched on, we offer a HRA. It's $750 for an individual that we give them back in order to help cover costs, and $1,500 for family. So we are also helping our employees in that way.
Yes.
DJ, could I ask a question?
Yes.
We've got a great plan, and a lot of people don't necessarily understand that. But if you've got somebody on, I'm going to say on the low end, making $30,000, something like that, $35,000, $40,000 a year, and they get hit with that $8,000, $10,000 cost exposure, it really hits them hard. Mm-hmm. Now, if they were on the $112,000 income or the $70,000 or somewhere in there, it still hits them, but it's not quite as hard, because it's such a big expense compared to their total income. Mm-hmm. Is there any way we can adjust that based upon person's income, so that slides a little bit, so that the person making the $112,000 would pay more than the person, or would have a chance of getting hit harder than the person that's making 30,000? Is that even feasible?
The short answer is no, but I think that the thought process is good, right? And how do we make it available for people to buy down their deductible, their expenses? I know that the court has evaluated and are looking at opportunities on the wellness front. A lot of times when we're asked these types of questions and we're evaluating how can we help people mitigate their potential risk or exposure, especially with a self-funded plan, what we want to have happen is for folks to take advantage of opportunities, but also have some level of skin in the game, right? That is going to help improve the overall health of themselves and the health of the plan. So I think evaluating opportunities like the company, we had a call recently that is wanting to help evaluate more wellness trends and chronic disease management trends to help offset. I think once that data is evaluated and maybe there's some additional opportunities that are available, we have had plans that have put things in place that say, hey, if you can meet these, you do these steps like engaging in healthy well-being activities, you're measuring your biometric levels or your blood work levels, you're evaluating that, you're working with someone to help offset or lower those costs and lower those risks, and then you get some level of incentive. I think that's worth exploring and seeing, what opportunities you can have, because it gets twofold, right? It's focused on the health of your employees and trying to make sure that they're taking that in their own hands and not just waiting for something to happen. And two, if we incentivize them to do that, it's available for people of, any economic, or salary base that can potentially help those folks offset their costs, maybe more so than just, a sliding scale deductible, things of that nature. So I don't know if that answers your question, but I think it's worth exploring and keeping that in mind as we're evaluating the health of our plan.
I think Brad's worked on some of that already as far as the wellness. I think Brad has been really good about that. But I'm just concerned because, if a $10,000 bill, and you're making $30,000, basically it almost puts you in bankruptcy in some cases. So that's my concern about the low earners that they can really kick them, and I just don't know how to help them. If something like that were to happen, that's just my concern.
No, it's a valid concern. It's a concern. I mean, I think the data out there that says that over 50% of the people don't have, $1,000 in savings account in the bank. And if you have, regardless of if you have a $2,000 deductible and you don't have $1,000 in savings, then it becomes a real hardship. What we're seeing in the marketplace is there are opportunities for additional financial education, partnering with local vendors, banks, things like that can provide additional help there. But the point is very valid. I think we do have to keep that in mind. It is a negative to the entire system, honestly, in healthcare that we, in order to, ideally you'd say, well, let's just do like a $500 deductible, right? And make it to where it's, affordable for everyone in healthcare. When we're doing that, we're also shifting a large amount of cost into the court's budget to help offset that. And with the rising cost of healthcare, it's very difficult to manage those lower deductible style plans. So, but the point is well received, and I think we do have to continue to keep that in mind. Any other questions on this?
I'm sorry, I just had one other thought.
Yeah.
What if you offered something if people they just take the single plan, like we lower the deductible on the single plan, the total out exposure down to encourage people, if they can get their families on a different plan and not on our plan, then that may be a good thing. Just thinking out of the box. I'm sorry.
Yeah, no, it's fine. There's availability for like waiver credits if someone waives their health coverage, and an opportunity to do that. Definitely worth continuing to evaluate and see what the cost benefit of opportunities like that are. for sure.
Okay, thank you.
Okay, so let's get into the renewal. So for the 2021 renewal, obviously to be expected, we had those rising costs this year. Anthem is asking for additional costs in relation to the renewal for this year. Admin costs were about a 3.3% increase, not large in the grand scheme of things, about an $1,800 increase in total cost difference for Anthem's administrative costs. They're requiring an 8% increase to stop loss and a 9% increase to expected claims. We negotiated this down significantly from where they came in at, using what we knew were not ongoing claims and where we expected the plan to rebound from some of those high claims in the last year. The negative side of this is that claims everywhere have been down this year. COVID has really made folks with elective procedures and things of that nature not go to the hospital. And some reports I've viewed that the hospital industry, the medical industry, is assuming somewhere about an 18 to 19% downtrend this year based on care that's just been delayed or lag, right? They just haven't gone. They're going to go. They haven't gone yet. So this it compounds the negativity on our end this year because we have some high claims from some few folks on the high claimants this year. Also, we're probably down on some folk on the rest of the population. So Anthem is sitting there looking at it saying, well, it's going to increase this next year. We're going to have to expect this increase. Plus we had losses this year. So that's where it's kind of come down to for us. The positive news is even with these increases based on what we did in the budget work prior to the last fiscal year or the beginning of the last fiscal year, this is still within our budget. Okay, we can still manage this expected exposure for the upcoming year, the upcoming calendar year, based on our budget projections at the beginning of this year. So that still stays within that 2.1 of expected liability. Now, I think that we do have to be aware that cost increase could occur based on claims, those lag claims coming into the plan towards the end of this year, the beginning of next year, and really monitor this closely. And ahead of the next fiscal year budget, we're going to have to evaluate, do we need to expect any kind of increase moving forward? And does that change either the amount of benefits that we are offering or the increase to employees' costs? We're not advocating for that at this time, but I think we're at the point where we really need to keep our eye on it and make sure, what the future health of the plan can hold.
And so everybody knows, over the last several years, as we had better than expected claims experience, we took the difference between our premium income and our claims outgo and put that away in an escrow account for a rainy day fund, as it were, in case we had a year of higher than expected claims. That could happen this fiscal year, but we are prepared. That rainy day fund's about $1.5 million, right in that neighborhood. Is that right, Brenda? Give me a thumbs up there. And as we budgeted for COVID, as you remember, we wanted to be very sensitive to out-of-pocket costs for employees while we tried to get them a 2% raise in a atmosphere where many people in the private sector were losing their jobs altogether. So in holding the line on insurance costs and also giving a 2% raise, I think we were very sensitive to our employees. And, at least through the end of this fiscal year, we're going to keep that premium level the same. And as DJ mentioned, as we go into next fiscal year, as we begin to think about that, we'll have to revisit this, see how our claim trends are going as we get closer to July 1, and see if we have to make an adjustment. I would love to not have to do that. I would love to make sure that any raises we give next fiscal year, aren't negatively impacted or counterbalanced or erased by increases in healthcare premiums, but we'll just have to see how that goes. You heard DJ say that what Anthem asked for in premiums for stop loss and premiums for expected claims that he was able to negotiate that down. Peel and Holland negotiated that down. And if you ever wonder what the value of having Peel and Holland on board with us is, that's a great example right there. Using their expertise, data, and knowledge of the industry to help us get the best deal possible is what Peel and Holland is all about in helping us. So thank you, DJ. That negotiating power adds up to a lot of money. It's not a little bit of money, it's a lot of money. So
Yeah, and thank you for that, Brad. The stop loss increase, the premium that we got down to an 8%, it started out at 18.5%. So 10% plus in stop loss premium. That equates to, we're at what, 280 something thousand in stop loss. So you're talking about a $30,000 swing on 10%. The claims expectation really is about our liability. And that had come in, can't remember the number. I want to say it was at it was 20 plus at least. That's a much larger swing because it is based on the total claims that we will have. But we want to move, even though that's not a number that we actually physically pay out, because it's just an expectation of claims, it increases our liability if we do have a really bad year, of what they call like a max claims year. If they get that at a higher rate than what is really truly expected, then if we have that bad year, then we're going to be on the hook for a lot more dollars, and that could be $200,000 swing with those dollar figures. So we try to do our best to make sure, our process is really trying to make sure that hold the insurance carrier accountable to know what is real, what is going on, what is it truly expected. Obviously, they're going to plan for the worst, and I get that. We need to be reasonable with what they're talking about, what they're looking for. We also need to know what's going on in the plan, what risk is not ongoing, and then how do we get them back to something that's more reasonable. So and we try to be fair, and obviously we lean on the side of getting as much as possible on for the court to make sure that we can continue to run this plan efficiently.
Well, do we only negotiate with Anthem, or do we have other carriers that we could negotiate with?
We can, yeah, we can evaluate other carriers, and the carriers in our space, the major carriers are United Healthcare and Humana. What we have found in the past when we've evaluated these is the network disparity and honestly, the discount disparity. This is one of the biggest problems with some of the other carriers in this region, in the Henderson County region, is that there is a significant disparity between the amount of discounts that some carriers will get versus others on their total claims. So if you are spending $1.4 million in claims, if you get 10% less of a discount, and that discount starts at, say I'm making these numbers up, but let's just walk with me for a minute. If we look at a $1.4 million spend, and we are getting just roughly a 50% discount, then initially those claims came in at around $2.8 million, right? And we paid half of them. If that discount is 10% less, then that 2.8 initial spend, we're spending 10% of that more. So it's, $280,000 swing on that alone. So that has become an issue, especially, there's a couple of hospital systems that truly affect us up in that region that make quite a bit of a difference. We do evaluate the marketplace to see what is available. There's also availability through other markets like, third-party administrators. But again, it's about trying to get to the lowest net number that we can for the county.
So you're talking about discounts. That's discounts from the hospital, where
Yes.
It would cost me $2.8 million. It cost them 1.4, right? That's what you're.
Yeah. So yeah, basically, yeah, these major networks like Anthem, United Healthcare, Humana, they're negotiating on a broad scale with these hospital systems and these providers and the doctors' offices. And what they do is they agree to a certain discount or agree to a certain bill charge, right? And so when that happens, then we have to keep that into effect, because we don't need to just look at, okay, what could you give me for 1 year as far as a negotiated renewal number? We really want to look at a longer term of what's going to keep us our lowest net cost. And if that's network discounts or pharmacy spend or whatever else, those are the things we're evaluating to make sure that Henderson County is getting the best deal possible.
And you evaluate these every year?
We don't go to market every year, and the reason being is it's kind of like the boy that cried wolf, right? If you go to a market to an insurer every single year and say, hey, give me your best dollar on the table, and you never take it, then they stop coming to the table. So we usually are doing that on a 2 to 3 year cycle, is getting a quote. Let's look at this. Let's evaluate our options, but also looking at the claims exposure versus those differences in network or differences in benefits like prescription benefits and things of that nature.
Right. Well, and the reason why I'm asking this is we've had a change in our medical facilities.
Sure.
I've had a company or a hospital across the river that bought our medical out. So those discounts could have changed. I was just wondering how often that.
Yeah, they certainly can. Sometimes it's worse, sometimes it's better. And it really kind of depends on the actual, the claims, the actual claims utilization, where it's going, where what providers are utilized. But overall, on average, we're seeing still a better overall discount when we're using the Anthem, the Blue Card network, and the nationwide network of it versus some of the others in the region. Not to say that will always be the case, but it has been up until this point.
Thank you.
Yeah, of course. Great questions. All right. So any questions on this renewal as the medical renewal? The other renewals that we have, dental with HRI is a rate hold. So that is the dental provider HRI, and vision with Anthem is a rate hold. So no changes to those programs or plans for this year. We'll be transitioning the HRA over to McGregor. It's a different administrator for that HRA benefit that we were talking about earlier. Main reasons for this transition are just easier access, more support from the McGregor team than what we were getting. The current administrator was WageWorks. And so that is a benefit to county employees. We'll get all of the information reporting from the current administrator and then transition that over to McGregor, so they know the balances that everyone has and can facilitate that administration. So from a member perspective, all they will have to know is that their WageWorks cards will work up until the end of the year, and then they'll need to transition over to a McGregor card or McGregor as far as their contact for that HRA benefit. Outside of that, everything's going to work as well as we can to get that transition. And once that happens, then they'll be our new administrator.
And we're gonna work closely with all the employees to try to make that transition as smooth as possible. All the money that they've saved up that would normally roll over will still be there for them. And just so you know, we had some customer service issues with WageWorks, as well as some challenges in some of their processes that made it easy for us to utilize their service. So we looked around for a better deal, better customer service, and settled on McGregor with the help of Peel and Holland in identifying that vendor. So thank you again.
Yeah. WageWorks, unfortunately, is kind of more of a call center approach, and it's hard to get somebody on the line that's really willing to help you. McGregor, we have identified contacts for our team here and for the employees that will make that a lot smoother if someone does have issues or concerns for that HRA. So keep it short and sweet. Our recommendation would be to renew with Anthem and hold rates and make no plan changes for the 2021 year. I think we can hold on to that. It will be imperative that we monitor that closely as this year comes to an end and the next year begins for the next fiscal year budget. and make sure that we can either sustain what claims and things are occurring over the course of the next 6 months and what we project out for the following, 6 to 12 months. And then at that point, we might have to make a recommendation that when we come back around here next year, we've already kind of set up an opportunity for any potential changes. But we would want to make sure that that's well in advance and we have plenty of time to evaluate that. And if there is a change, that we educate folks well in advance of it. But I think we can hold for now. We've got the escrow. That's a credit to the team and Brenda and the team of at the court to make sure that we're managing the financials of this plan when it comes to self-funding. But some things are out of control, and claims that come in, claims that could be coming in post-COVID are ones that we won't really have a whole lot of a chance to deal anything with, but we need to make sure that we're evaluating and managing that for the future to continue to offer great benefits to Henderson County Court employees. So we also recommend that we're holding rates for the dental and vision, so no changes there. And we'd recommend that you renew your contract with Peel and Holland. So that's all I have for this. Are there any questions?
One thing to note is we made a decision at the beginning of the pandemic to make sure that no employee who went for a test had to pay any copay on that test. It was all going to be on our dime as a further way to help employees during these unusual times. So, and we have not seen a huge influx in added cost due to that, but we were sensitive to the idea that employees would have to get tests or want to get tests, and we didn't want to take any money out of their pocket for that. So, any other questions for DJ? Thank you, DJ. Appreciate all you do. It's good to know that we can at least hold the line here for until the end of this fiscal year, and we can review as we go next year. You have in your packets a resolution reflecting the proposition to renew our contract with Peel and Holland, as well as the addressing the vision and dental benefits, correct? And I'd like to have the clerk read that, and then we can have some discussion if anybody has any. So, Mr. Clerk, if you want to read that resolution.
Resolution authorizing county judge executive to execute insurance contracts. Whereas the Henderson County Fiscal Court provides various health insurance benefits to its employees through a self-funded insurance plan. And whereas Peel and Holland is a health insurance broker that provides benefits advisory services to the fiscal court. Whereas the Henderson County Fiscal Court, in consultation with Peel and Holland, deems it in the best interest of Henderson County to enter into an administrative services only ASO relationship with Anthem Insurance Companies Incorporated for the administration of Henderson County Employee Health Plan. And whereas the Henderson County Fiscal Court, in consultation with Peel and Holland, has selected Health Resources Incorporated to be the provider for the employee dental insurance. Now therefore be resolved by the Fiscal Court, County of Henderson, Kentucky as follows. That the Henderson County Fiscal Court hereby authorizes and directs County Judge Executive Brad Schneider to execute the attached contracts and agreements related to the administration of employee benefits. Anthem SO contract, Anthem ASO standard pricing assumptions, Anthem ASO standard stop loss assumptions, dental health options renewal contract, Peel and Holland benefit advisory agreement. Furthermore, the county judge executive is hereby authorized to execute any and all other necessary and appropriate documents required to effectuate the intent and terms thereof.
And I said vision, that's included in the Anthem plan. Not, we have to go to HRI for our dental, so that's why there's a thing in there. And DJ, just to make note of this, your fees, Peel and Holland fees with us increased slightly. Is that correct? Or did they stay the same?
I think we stayed the same. I don't know that we've made any additional increase. I've had a lot of these recently, but I'm 99% certain that we just held fees for this year, that there was no additional change. Yep.
Any questions about the resolution or re-upping with Peel and Holland? Against my personal opinion, they do us a great service. They provide expertise we don't have, and their negotiations with Anthem save us a lot of money.
Brad, I agree. And I mean, with your leadership, with putting that money aside we've got in case of an emergency, I think has really been important. I'd make a motion to approve.
I second.
We have a motion from Magistrate McCollum, a second from Magistrate Southard. I appreciate that comment, Charlie. We've certainly been trying hard. And, the establishment of the fund was an important step forward for this plan. We did not have it before. And we had in 2015 and 16, we had high claims years. It's satisfying to have done that and put us in a better position after Peel and Holland have been poking at us for quite some time to do that. So, glad we're able to do that. So we have a motion and a second. Any other discussion? All those in favor say aye.
Aye.
Any opposed? Thank you. And thank you very much, DJ, for that information. If anybody wants a copy of that presentation, we'll be happy to get it to you. I think it's got valuable information.
Brad, can I make a suggestion in that regard?
Sure.
Would you mind telling all the department heads? I think it would be good if the department heads could tell their employees, they can go to Facebook or wherever and look at the recording of this meeting. It's really got a lot of valuable information. Plus, it sort of explains why we do what we have to do. I really think it would be good if the employees saw that.
We will. We did make the comparison table available, but in the context of that whole presentation, I think it's even more effective. So, DJ, send me a copy of that. We'll disseminate it to the court and we'll disseminate it to department heads. I'm going to think more about that. We need to get more information to our employees. To let them know that our plan is very competitively priced and in some cases better. And number two, self-insurance has benefits, but it also has some challenges. But in the end, I think if we went to a fully insured plan, like we went to KCO or the state, it would cost us all more money. I don't think there's any doubt about that. Some of the coverages might be different, but in the end, it would cost us all more money. It's less hassle, of course, but to save our people money and to keep prices as low as we can, I think it's worth the trouble. So
100% is, and I'll add one comment there, Judge, is that the benefit that I will say being a fiscal court and a public employer is, and especially with self-funding is that we can run this thing well. And if we do it well and we manage the things we can manage and take care of it, then we can be in a good spot for a long time. But if that bad day happens, that bad year, or that bad string of years happens with claims and increased risks, we do have a parachute that not everyone has in relation to the state, and that can sometimes save. We've transitioned fiscal courts over that had a successful self-funded program for a number of years, and then the claims got too bad in one direction. We had to bail out and go to the state plan, and so it is nice that we can do the right things, we can manage it well, but there's certain things that are just outside of our control. The positive news for the court is that there is an opportunity if that day ever does happen.
excellent. Okay, we have a motion and a second. Any other questions? All those in favor say aye.
Aye.
Any opposed? Thank you, and thank you, DJ. We will
Thank you very much.
talk to you again soon.
Mhm.
You have in your packets the sheriff's monthly report. Give you a chance to review those and a motion to accept those.
I move to accept.
Second.
We have a motion from Master Southard, second from Master Moran. Any questions? All those in favor say aye.
Aye.
Thank you. Mr. Gold, your report?
Judge, on we have a few cases or a few checks, I'm sorry, been in court too long lately, and I'm still thinking cases. We have a few checks that we've turned over. County attorney budget employees, dental and life insurance, $457.56. Health insurance, for county attorney budget employees, $6,341, and Aflac, $124.94 for today's total $6,923.50, bringing the fiscal year total to date to $79,135.64.
Make a motion to accept.
Second.
We have a motion from Magistrate McCollum, a second from Magistrate Barry. Any questions? All those in favor say aye.
Aye.
Any opposed? Thank you, Mr. Gold. Treasurer Ryder has a few items here, including a budget amendment, and I will let her explain the amendment.
Okay, this is the budget amendment number 1 for this fiscal year. And what this is doing is budgeting into the current fiscal year budget revenue with corresponding appropriations that was unknown or unexpected at budget time. For the general fund, unanticipated revenues received from property insurance claims reimbursement for the Sheriff's Department. Also from the general fund, unanticipated revenues from the CTCL, which is Center for Technology and Civic Life. This is a grant, a private foundation grant that was issued to the clerk, and it was issued for safe and secure election administration for this fiscal year.
The county clerk.
County clerk, I'm sorry. Also, for federal funds, unanticipated revenues from federal funds, the CARES Act. And what this is for is through the State Board of Elections, the clerks were assisted with federal funds for the June 2020 primary as well as the November 2020 general election. Increasing receipts to the total amount is, I don't have that.
You can add that up real quick.
I apologize. Increasing the receipts with the offsetting appropriations is the amount of $59,701. In the general fund, the proceeds for property and casualty insurance of $12,000 with the offsetting appropriation for vehicle repair for the sheriff. From the general fund, for the clerk, for the CTCL revenue in the amount of $24,661. The offsetting appropriation for that is for the appropriation of general fund, election materials and supplies. In the federal grants fund, from prior year carryover is $7,680, and that represents the amount that the State Board of Elections forwarded to the clerk for the June election. And actually there was a timing issue is why it's in prior year carryover. Also in the general fund is the COVID-19 CARES from the State Board of Elections in the amount of $15,360. The total of these two are the appropriation will be to the federal grants fund COVID-19 CARES appropriation line, which will in the future, after this budget amendment is approved, will be moved over to follow the appropriations that are required by the clerk.
Now we've gone over the ordinance document. Mr. Gold, can you advise me whether we have to have the clerk read it again, or is the treasurer's summary sufficient?
Well, I believe it can be passed by summary, yes.
Okay.
The
Well, I mean,
statute's clear on it.
summary by the treasurer. We don't have to have the fiscal court clerk read it.
If that is acceptable to the members of the fiscal court, then yes.
It's acceptable to me.
I'm good.
We just went over all the numbers and the reason for the amendment. So consider that a first reading of all the numbers in the amendment. Any other questions of Brenda? Again, the good news here is we're amending it for income and not necessarily expense.
I'd make a motion to approve.
Second.
We have a motion by Master McCollum, a second by Master Putman. Any other questions? All those in favor of this first reading, say aye.
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 Any opposed? Okay, thank you. And Ms. Ryder, would you continue? Do you have any fund transfers?
No, sir, I have no fund transfers for today. I do have one claim in the road fund to Garrett Concrete Services in the amount of $11,750. This is 3 invoices for concrete work that was done for Thorn Ridge subdivision, Spring Meadow subdivision, and Country Club subdivision. And this is to come from the contracted construction appropriation line of the road department.
Motion to accept the claims.
I move to pay the claims.
Second.
Motion from Magistrate Putman, second by Magistrate Barry. Any questions? All those in favor say aye.
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 Any opposed? Anything else, Treasurer Ryder?
No, thank you.
Before we go into good of the county, I wanted to correct an oversight and thank you for Magistrate McCollum for pointing this out. I'd like to ask for approval of 2 new hires, Teresa Childers at $36,000 as Parks and Rec Director for the county, and Nancy Watkins rehired as Recycling Coordinator after a brief foray into the Postal Service. We were able to get her back, and she couldn't wait to come back, and she's one of the best recycling directors we've had. She'll be at her normal salary she had before, $40,000. So get a motion to approve those 2 hires.
I make a motion to approve that.
I second it.
The motion from Magistrate McCollum, second by Magistrate Putman. Thank you very much. Any other questions about that? And again, my apologies. All those in favor say aye.
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 Any opposed? Okay, we'll go to the good of the county, and I'd like to start out with Mr. Gold, if you don't mind.
Thank you, Judge. I want to kind of go back to the Domestic Violence Awareness Month. Could have said this then, but I didn't really want to step on what was going on with Andrea and Oasis and all the good work that they're doing. But it couldn't come at a more fitting time, Domestic Violence Awareness Month. And I've got my purple Domestic Violence Awareness Month tie on. Yesterday afternoon, we found out that our grant, Victims of Crime Act grant for our victims advocate has been renewed. We were very nervous about that due to COVID and the budget shortfalls, both at the state and federal level. So we're very excited because that has really transformed the way we've been able to deal with victims of domestic violence and get them to the help that they need. And we've had a great partnership with both Oasis and the Chloe Randolph organization and local providers. Domestic violence is a much bigger public health issue than people understand. We see it in our emergency rooms. We see it in mental health providers. It happens in front of kids and the long-term effects on kids. But Henderson County is really taking its response to domestic violence to an even higher level. We're empowering people in those domestic violence situations, men and women, to know that there's help, and we're erasing those barriers to them getting that help, whether it's shelter, counseling, making sure that they have employment, the ability to leave those situations. And that's really something that has been needed for a while, a more comprehensive approach. We've had a good approach in Henderson for years, but it's time to move it forward. And the grant that we've received is going to help us do that. The next step in that, and you're going to hear me talking about this quite a bit for the next month or two, and maybe even more, is to get all of our local law enforcement agencies to use a validated lethality assessment at every domestic violence call. That's something where they go through some things, looking for some specific clues for potentially lethal domestic violence situations to help them guide how they should respond in those situations. And it's being used in other localities around the nation, and some very close to us, like Evansville and Owensboro. And that's something that we're going to be trying to work with the Chloe Randolph organization, Oasis, and local law enforcement to make sure it gets implemented here. So that's a lot of good things going on the Henderson County response to domestic violence front. And I think that's a very positive thing for our community.
Steve, I would like to thank you for what you're doing for our community. Unless you've seen it, it's really hard to believe that it really exists like this. And it's had a dramatic effect on my life on just seeing what I saw. We had a case when I was county attorney where the woman lived out in Geneva. The husband kept her with no money, no assets, no way to get out of there. She was in a little tenant house. The husband made a fatal mistake in that he failed to pay the rent, and he gave her the rent money, which gave her an avenue to escape. He went to Oasis. The police and sheriff had been called out several times, but you know, she was absolutely scared to death. When the little boy took the stand at the trial, the father left his seat, and when the little boy saw that he was not there, he peed on himself. I mean, you can't get over that when that child had that much fear, and because he had watched all this domestic violence. But thank you for what you all are doing. Thank you.
Thank you. And it is heartbreaking, but we as a community are doing better and going to be able to do even better as we move forward.
Thank you, Steve. Anything else? Steve, from you?
No, sir. Thank you.
I got one more question for Steve. I'm sorry. What's the judicial center like? I know the chillers were down. The temperature was 90 degrees yesterday.
We've been told that we're supposed to be Zoom court for the rest of the week. One of the divisions in district court had been doing a hybrid court where we were doing some live court. So we've not been over there today. We've been told to stay over here and be virtual for the rest of the week.
Thank you.
And I can give a little bit of update on that, Master McCullum. The chiller project is expensive, and we've got approval from AOC that they'll pick up the cost. When the old chillers were removed, extensively eroded piping and connections and cables were found. You know, surprise, surprise. You don't know that's the case until you pull those big units off. Replacing all that is another big ticket item. We are pushing AOC to pay for that. It was not anticipated, probably not surprising, but not anticipated in the original quote. Wrangling with AOC, but I think we're going to get our way because it's part of the whole system that we're trying to improve. So stay tuned. It hasn't delayed the replacement too badly. The big new systems are up there ready to go. So hopefully soon this will be fixed and the AOC will be paying for it as it should. And,
Right.
We'll have a better report.
When they redid that, Brad, did anybody look at engineering to see if there was some way we could re-engineer that? Because the cost of the way that chiller has to work 24/7 all year round, and even in the wintertime, which doesn't really totally make sense to me. I always thought you could put a smaller chiller in the wintertime where you know, because you don't need the chilling that much, but with, I don't know, just a thought.
Not an engineer. I don't know. I think they were looking at the most cost-effective fix and completely re-engineering it. I don't even know if that was an option.
Okay. Okay.
I encourage you to call.
Forever. It was
I
just
encourage you to call Charlie Ransom, our maintenance director. He can give you a centimeter by centimeter accounting of what's been going on because he's been living over there basically for the last week and a half.
Thank you.
Before we get to the rest of the magistrates, I know that Mr. Hubiak, our county engineer, addressed the road committee this morning with a specific ask, and I want to turn the floor over to him to brief the court on what he's requested. Yeah, hang on, come on up here.
This morning, as we discussed this morning, I would like to be able to add into or move over from the fiscal court's budget, $225,000 more dollars to the line item of surface blacktop for the county. That will give us an additional 1 extra mile for District 1, 2, and 3.
That's 3 miles total.
3 miles total. Yes, sir. And approximately $75,000 a mile for 1.5 inches of overlay. We do have 330 miles of hard surface roads to maintain. We definitely can use this at this point because our roads, due to the past several years with the amount of rainfall, and some freeze and thaw that we've had, have deteriorated. And I think it's in the best interest of the county to try to do a little bit more than what we had originally budgeted for.
And there are a couple particular roads you wanted to address, right?
Yes, sir. Well, we've gone through each of the magistrates, District 1, 2, and 3. This will enable us to actually do all the roads that we had prioritized on their list. Some of them have 4, 5, and 6 roads that they picked out that were in the poorest conditions. And this will enable us to complete that list for each of the 3 districts.
I want to,
Bill, 5 years ago or so, whenever we were having financial difficulties, didn't the county road department have to cut back what they did?
That is correct, Magistrate McCollum. And as everybody knows, when you have to cut your budget, it's either manpower or materials, and we chose to do the materials at the time, and that has affected our condition of our roads.
hey, Master McCollum, I need you to turn your video back on.
I don't know how to do it. I'm lost. I tried to switch the page and now I'm looking at some pro wrestling thing.
Well, I would suggest,
I'll turn it off.
Charlie, leave the meeting and rejoin the meeting. We need to be able to see your face. If I'm not mistaken,
Okay.
Mr. Gold, but that's part of the requirement here. But while he's doing that, leaving the meeting and reconnecting, one thing I want to clarify. There you go, Charlie. We can see you again. As Master McCullum mentioned, we had to make some choices several years ago, and asphalting and rocking were 2 of the places that suffered while we got the finances back in order. Ever since then, we've slowly been ramping up those line items again and spending more money, but it's been a slow build. This request for $225,000 extra dollars for paving will not be an expansion of our budget or the road department's budget. This money will be coming from the money we hold out for the road department. We call it transfer in money to help subsidize the road department. We subsidize about half the road department's budget every year. And this is money that Mr. Hubiak can request after he has exhausted his initial revenues, which the road department gets from state sources, federal sources, local sources, fees and culvert sales and things like that. That adds up to about half of his budget. As he spends through that money and heads into the other half of the budget, we have money called transfer in money that we hold back for him. We budget and hold back for the road department, and he requests it as he needs it. Each of the last several years, Mr. Hubiak has not come close to requesting all of that money. He's been very frugal. He's been very smart. He doesn't spend money that he knows is a waste or not will not create an immediate benefit. And that's been terrific. It's several $100,000 each year that he has not requested. Even as I've encouraged him the last couple of years to use whatever he thought was needed. This money this time around, this extra $225,000 will be added to his asphalt line item, and it will come from transfer in. And that, again, that's already budgeted. It will not change his overall budget. It will not change the county's overall budget. This won't require a budget amendment. It's just a simple transfer. And so I would very much support this. He's identified these opportunities. I trust his judgment because of how reticent he's been to ask for anything extra over the last few years. And I just want to put those 2 cents and make everybody watching in public aware that this is not a unnecessary expenditure or an extra amount of money outside of our current budget.
Well, our roads went down so bad, Brad, before you were here. I mean, before you were the county judge, it was quite significant. I don't see any other way that we catch up unless we do this. I'd like to make a motion that we approve.
I second.
We have a motion from Magistrate McCollum, a second from Magistrate Southern. And as the road department discussed briefly this morning, just to add to this discussion, next year when we budget, we can add a lot more money to that paving line item or the rocking line item or anything else that we are still trying to catch up on when it comes to physical improvements to our county infrastructure. We have the capacity to do that. Again, that transfer in amount has been pretty steady over the last few years. Bill has not asked for it all. I'm encouraging to ask for as much as he needs, especially when it comes to asphalting. So we can increase the line item next year as we budget for specifically this sort of work to catch up in the quality of our roads, as Manager McCollum said we need to do. And I think we all agree that's true. So something to keep in the back of our minds as we budget for next year. That way, Bill won't have to come to us and increase that line item in order to continue to add more asphalt.
Brad, if we don't have the infrastructure, we're not going to get new businesses in Henderson County. I just think this is really important.
Amen. And please tell that to the state as they debate how much revenue and spending they're going to do on infrastructure, including a certain bridge that is very close to my heart. So
yeah, don't get me started with our state. I'm sorry.
So we have a motion and a second to make that transfer, to have Brenda Ryder make that transfer in and help Bill add more asphalt. Any other questions? All those in favor say aye.
Aye.
Any opposed? Thank you. We also have on the line Kenny Garrett.
I have one more request today before.
Oh, I'm sorry. I'm sorry, Bill.
Time out. What, one more?
Yeah, I'd like to be able to go out for bid for a new dump truck for the road department. This is a budgeted item that we want to go out for bid request.
Get a motion in that regard.
Make a motion.
Second.
Motion by Master Barry, second by Master McCollum. It is a budgeted item, as Mr. Ubiak said. Good luck with that. Try to get us a good deal. All those in favor say aye.
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 Any opposed? Thank you. Okay, Bill, anything else?
No, that's it.
Nothing
Thanks
for
very
you?
much.
Okay. Kenny, turn to you. I know the increase in positive tests in this community is a huge point of discussion now. We are officially a red county in the state's matrix of evaluation. Anything you want to add to this discussion or what you've been up to lately to try to assist?
Well, I mean, we're still in response mode here. So, I mean, working with public health and monitoring the situation as we go through this roller coaster ride of cases. One day we're a little less than the next, and then we're up again. And thank goodness it's not any more deadly than what it is. So, I mean, I say that, and we just don't know how it's going to affect some of the ones. I mean, we know it can be bad, of course, but I'm hoping that that we can get these numbers down. And the best way to do that is just to follow the guidance and, keep our distance from folks. I think that's probably the most important part right now is just to keep our distance. The masks are important and sanitation and things like that, sanitizing your hands and stuff. But keeping our distance is really, I think, the key moving forward. So, we're still managing PPE requests to the departments as needed. I'm working with the county clerk's office to get them ready for the election. We've already got some PPE out there. So just all the basic stuff that we've been working on. I think we've got somewhere in the neighborhood of 130 real-time responses, everything from tornadoes to hazmat to car wrecks to house fires that we're still doing in addition to all the COVID. So it's been a busy year. So, but I guess my plea to everyone would be just to follow that guidance and hopefully we can get these number of cases back down to, something more manageable.
You are in the midst of helping compile all of the numbers we'll need to make our request for reimbursement from CARES Act money that's been available to counties. We have approximately 1.4 million that we can request as reimbursement. That is on track.
That is on track. I'm gonna actually get with Brenda later, if not today, later this week, and try to get everything ready to go by at least the last week of this month before the deadline of the first of November.
And I believe at our next fiscal court meeting, if I'm not mistaken, we'll have to pass a resolution making our first application. Is that correct?
Correct.
Okay. We'll double check that. We've already passed the first resolution that says that we're going to make an application, then we go ahead and make the application. We'll double check. I see Kurt Wiesen shaking his head. Do we have to have another I think we can just go ahead and make the application. Is that what yeah. Okay. Well, there you go. It would be nice to have a briefing by next fiscal court meeting to let the fiscal court look at the compilation of numbers and see what we're going to be asking for. The state has asked that we get it all in by November 1. I do, if you don't mind, Kenny, get clarification from them that we can make a second application before the end of the calendar year, because that was the deadline they initially gave cities and counties. And there will be some expenses we have between November 1, I'm sure, and the end of the year. We should be able to get reimbursement as long as we're not past our $1.4 million cap.
Right.
Yeah.
All right.
Anything else, Kenny?
No, sir. Thank you.
Thank you. Okay, we'll go around for more. Go to the county. Master Putman.
No, thank you, Judge. Again, I appreciate your remarks that you and the mayor made last Friday. I tuned in, listened to both of you. I think it's very appropriate. And as Kenny just spoke, as just do what we need to do on this COVID virus. It is getting the numbers are kind of getting out of hand, as it appears. But anyway, wear your mask, wash your hands, and social distance. Everything else is good in the fourth, Judge. Thank you.
Thank you. Master Moran.
I'd like to thank Bill and the road department for the extra mile. District 2 really appreciates it and needs it. Thank you so much. I'd also like to, this is the first day of in-person voting, and I'd like to encourage everybody to please get out and vote early. And everything's well in District 2.
To piggyback on that thought, Master Moran, early voting is currently underway. There are 2 locations to early vote, one in the courthouse, one at the Chase Fulcher Archery Center up by the high school. It'll be normal business hours here at the courthouse that people can drop by and early vote. Regular business hours out at the archery center, and some Saturday hours that they'll be able to early vote as well. Call 826-3906, County Clerk's Office, 826-3906 for any added questions about that or the actual schedule, the specific schedule. And for all watching it, if you come to the courthouse to vote early, keep social distance, please. As you line up, make sure you stay 6 feet apart. We had a big crowd right at 8 a.m. and it was extending out the door to the street, and there were way too many people too close together. And I will reiterate, you have until from October today up until I think the last day before the election to early vote, and then there'll be election opportunities on the day. Voting opportunities on the day of the election. So there's plenty of time. You don't have to rush. There's plenty of time. Take advantage of that opportunity if you need to. Master McCullough, any thoughts for good of the county?
Well, I would like to just go with what Kenny said. We've this thing about masks and stuff, we're not trying to step on anybody's toes, but it protects everybody else in case somebody, if you maybe have the virus and don't know it, it helps you from spreading it, and it does help protect you too. We're not trying to take anybody's rights away. We want to protect our community, and I just would encourage everybody to follow the guidelines and social distance. This is really important. You see what happened at Red Banks, and the elderly, if they get it, they don't, I mean, it really hurts them. And once it gets in a community like that, it spreads. It's something we got to watch, and we got to work together to beat this thing. Thank you. And everything else is good in the county or in the 5th district. I appreciate what Bill's done and what everybody's done, all the people here working with the court system. We've got a really good group of people, and I just don't know what else to say. Thank you all.
Thank you. Master Southern.
I'd just like to say a thank you to Andrea again. We gotta have people that's willing to step up and help the people that are really in need. Jay Randolph and his family are personal friends of mine. My hat's off to them. The passion they put to this, to the Randolph organization is phenomenal. And knowing that Jay and Christy are working on it and they're going to make things better. And that's something that we all should be passionate about, because nobody should be bullied. Nobody should live in fear, and every child should be loved, not whipped. And that's just how I really feel. And I like to thank Bill. He's done a good job down here on our roads. He's budget minded, and he does a really good job. And all's good in the third.
Master Southern, how's harvest going?
Slow.
Other than combine fires, how is harvest going?
We actually replaced our combine. We've got things going our way, I hope.
I was glad to see, believe it or not, I was glad to see your video of your combine fire, because that meant you were not in the combine as it was on fire. So good luck to you. And
I say too, I really appreciate the volunteer fire department. 10 minutes, 911 was called, 10 minutes they were to the field, and we were not in the easiest place to get to. So that says something for them. I'm just going to tell everybody in my district that $50 is well spent. So it's when you need them is when you really realize that. So thank them very much.
You mentioned that during your initial social media post about that, and I appreciated it. And their quick action helped save some of the field, or most of the field, from turning into a field fire.
Yes.
Yeah. So fantastic, and thank you. And I'm glad you're safe. I did not ask the harvest question to set you up to talk about your combine. It just occurred to me as we were doing it. I'm glad you're safe. I'm glad you're safe. That fire was something to see, and you said it took all of 8 seconds to go from a little bit of smoke to fully engulfed, and you were able to get out of that.
Oh yeah.
Yeah.
Yeah, it was extremely fast.
Yeah. Thank goodness. Thank goodness. Master Barry.
Thank you, Judge. I don't know. Everybody's covered everything I was going to say. If you could tell me to talk about it, I might. No, but I just thank everybody for the job they do. Thank all of our county employees. We have an excellent crew. Kenny, I totally agree with what you said about the mask, and Butch, and that if everybody would do what they're supposed to, and I think we can get through this thing. So your comments were well respected. I like what you said. The only thing I'd say, Bill, I want to thank Bill on our roads, and I do appreciate that extra blacktop. We desperately need it. Bill suggested that we go out and rate our roads in our districts back earlier, which we did. And I think that was a very, very good way to do it. So we did it. We reported back to Bill, and he done a good job. We've got a little bit of extra money that's going to help a whole lot in each district. And we appreciate that. I know everybody does. So thank you, Judge, and everybody. We're good, District 1.
Thank you. And on my behalf, I'll say that this week was supposed to be the State of the City, State of the County luncheon that the Chamber hosts every year. Gives the mayor and I an opportunity to update the community on how we think things are going. And that had to be postponed because of COVID, and then there'll be a new date set. But I was ready to talk about it. I was getting ready to kind of give what I thought were the important points the community needs to hear. And I'll do that briefly right now. I mean, this will take a minute, and I'm going to expand on this later this week. And again, I'll have a chance to talk about it in person when the chamber reschedules. But I want to say that the state of Henderson County is challenging right now. And for many reasons that we all know. The state of Henderson County government is good. I think we've all worked to make our government as stable, as efficient, and as prepared as it could be, I think, for what's going to happen in the next 12 months, 2 years. We are in a good shape at the county government. The county as a whole, obviously, is very challenged. Our economy is still puttering along. We've lost several businesses due to the pandemic. I know small business people in this community are working their tails off to try to get back to a point where they don't fear they're going to lose their business. And we really admire them. They're heroes. The small business community here is what makes Henderson and Henderson County the community it is. Our big businesses are trying to ramp up, but because of several factors, they have a hard time hiring people. So that's a challenge for them. There are more jobs available in this county right now than I can recall at some of our big employers. So anybody who needs a job can have a job right now, but I know there are various factors that can keep people from coming back to work. 2 weeks ago, the Kentucky Supreme Court ruled that instant racing was unconstitutional, not unconstitutional, but had run afoul of the law, was not legal, as it had been for 2 years. That is a challenge for us because Ellis Park relies on revenue from their instant racing facility to keep Ellis Park alive and to also help benefit purses that make the races attractive enough for their handle to be large enough to keep the business open. And the new ownership, Laguna Development, bought the track based on the ability to bring in revenue from instant racing. And now they are behind the 8 ball, and probably the only solution at this point is to have the General Assembly change that law to allow instant racing specifically, or probably in my perspective, even more practical, is just to allow casino gaming completely under the auspices of the racetracks, both for on-track, on-site casinos or track-owned casinos that have freestanding facilities in our communities. Now, regardless of how you feel about gaming, all around us, states have those facilities. Kentuckians take their money across borders all the time to choose those entertainment venues. We are shooting ourselves in the foot, and we have now put a major threat in the way of both Ellis Park and Turfway Park, the smaller of the 4 Kentucky tracks. So you're going to be hearing more about that. And I'm already part of a group that's hoping to express to the General Assembly how important this is, not only to Henderson County, but counties around us and counties throughout Western Kentucky. There are several other ongoing situations that threaten the economic viability of both the city of Henderson and Henderson County that are hopefully going to reach decent resolution soon. But I think all of you and myself as well are concerned about how we're going to come out of this pandemic as a community. This is going to change Henderson County. It's going to change communities across the country. How we respond, how we address the new normal after the pandemic hopefully begins to ease at a point where we can reopen our businesses and our schools, our hospitals. That will be the key as to what happens over the next 20 years in Henderson County. I really believe that. This situation is unprecedented. The challenges are unprecedented for us. And we are really going to have to come together as a community, as a fiscal court, as a city commission to help get us through these times if we want to see Henderson County continue to prosper. I can't say enough that I'm not trying to be hyperbolic here. I think this is truly a challenge for us. And I'm really glad that we have the fiscal court we've got now to help us do what county government can do to assist in this and to be leaders as we try to figure out how to best help our community. But it is going to require our help. It is going to require our creativity. It's going to require our ability to take ideas from other communities maybe and implement them here, work with the city to do that. We've got a lot of work to do in the next 12 to 24 months. A lot of work. The community has a lot of work. I take a lot of confidence because I know Henderson Countyans are good people. They're great people. They're willing to work hard. They're willing to do the right thing. But it's going to be a challenge. And I hope everybody understands that. I'm not trying to be negative, I'm trying to be realistic. And with that, I'll be talking more about that in the future. Not to leave on a negative note, because I just said we are a resilient community. We have resilient people. We have great people here. And that gives me hope and confidence that we will get back to where we need to go. But it's going to take us all pitching in together, truly. Pitching in, county and city governments included. So with that, I will leave us all ready to gear up and do what we can to help our community, our people, including wearing masks, social distancing, washing our hands, all those good things. And if anybody doesn't have anything else, I'll entertain a motion to adjourn.
So moved.
Second.
A motion from Magistrate Southard, second from Magistrate Moran, and all those in favor can sign off. See you soon.
Yeah.